Hi, welcome to my Medicare 101 orientation. This is what I do with clients each day in my office. And so I'm recording this in case we've had one of these conversations and you want to review it again. So on my website, lowcostcahealth.com, you'll see this Medicare section. Go to Medicare Insurance Resources. Here's where you're going to find recordings like this, as well as materials that I've created. So I always start with people on this Medicare Insurance 101 brochure that I've created. So you can open that up. You can print this for your own use. So when I'm working with clients, first of all, it's when do I need to enroll in Medicare? How do I enroll? Those directions are here. Each of you may be coming from a different place, so I'm not going to highlight that in this video. Also, here's a reminder that choices that you make are not necessarily for life. Your Medicare supplements, we can change the month of your birthday living here in California. And your prescription drug plans, there's an open enrollment each year between October 15th and December 7th to make a change for the next year. So let's go to the general lay of the land. This is information that is valid for the year of 2022. So if you're listening at this at a different year, know that this may be a little bit outdated. The first and most basic thing you need is enrolling in Medicare. Medicare is the part that you get from the government. The government doesn't care about all this stuff that we do in the private world. They just want to know, do you need Medicare? So I have another website about unraveling the mysteries of Medicare, and I break people down into a number of different categories. You're either what I nickname the cruisers. You're already taking Social Security benefits. Your Medicare card's just going to show up in the mail. No action required. If you're still working and have health insurance from your employer, and your employer has more than 20 employees, you can contact Medicare and let them know you don't want the Part B that you have to pay for now, or you may want to consider the fact that this may be better coverage than you have from work. Instead of A and B, I personally tell people to think of it as in and out. No, not the burger, but inpatient and outpatient. Part A only pays when you're an inpatient in the hospital, and Part B pays everything that's outpatient. So when people ask me, do you need Part B? Do you need coverage for doctors, labs, x-rays, outpatient surgeries? If the answer is yes, the answer is yes. A is usually free for most people. You've worked your 40 quarters and you've paid your taxes. This part's all taken care of. Part B, there is a nominal charge for that. In 2022, the standard charge is $170.10 a month, but the government does love to penalize successful people. It's totally their thing. So look at the chart below. Are you single or filing your taxes as single? Are you married filing joint? Look at these incomes. If you're single, under $91,000 of income in 2020, or joint, find it with income under 182,000, you're going to pay the standard amount. These amounts, if you're making more income than that, are the penalty for success. It's the 170.10 plus a penalty. They call it IRMA. No, not your new girlfriend, but income related monthly adjustment amount. If you were making money in 2020 on your taxes, but now maybe you've retired, you're now widowed, or you recently got married since then, you can file an appeal and get these things adjusted. They don't know your current information because you haven't filed taxes for that year yet. So you can file an appeal if this is no longer valid for you. Otherwise, I guess if you have to be penalized for something, being successful is a good reason. So there's holes in Medicare. These are the holes. You have two choices. You're now like the Great Wall of China, the big wall between what happens here in the government provided world and what we want to do in the private world to work with Medicare. So there are two. very distinctly different planets that you can choose to live on. In our first galaxy, we have Medicare supplement or gap plan with a prescription drug plan. So in this scenario, Medicare's doing its thing. It's adjusting all the bills. It's telling doctors and hospitals how much they'll get paid and what things are covered. And we have these holes. This is kind of a summary of the holes that are in Medicare. So the supplement walks behind. Think of this as like the horses and elephants in the parade. We all know what happens when you have horses and elephants in the parade. Things get left behind on the pavement. And we have our pooper scooper supplement. It's going to walk behind and pick up those pieces. Will it pick up all the pieces? Will it pick up all the pieces except for one deductible? Will it pick up half the pieces? You get to choose which supplement, price, and what works for you. One thing that people don't understand about supplements is that these are standardized by law. So any company selling a G, their plan G looks like everybody else's plan G. They might throw in maybe a little token coupon for some dental or something on the side to incentivize you to work with them. But I tell people it's sort of like this exercise. I'm going to tell you to go to 3 grocery stores, buy a can of Campbell's tomato soup. You bring those cans home, you set them on your kitchen counter, and you look at them and you cannot tell the difference. They all look the same. But every store that you went to, if you look at the receipt, charged you a different price for that soup. So for me, it's finding which is the best plan for your needs, and then where can I get it for the least amount of money? Winner, winner, chicken dinner. That's the company that wins the business for you. Different ages and different zip codes will all have different rates. We have tools that help us look that up for you. And then Medicare doesn't cover prescription drugs that you get from a pharmacy and that you administer to yourself. Part A, inpatient, it will pay for drugs you get in the hospital. Part B will pay for any infusions or things that you get in a clinical situation. But prescriptions that you might go pick up at the pharmacy and give to yourself, and the shingle shot, for reasons I don't understand, are covered by Part D. So there are 26 different drug plans in California right now in 2022. We have software that will help you pick the correct one for you. So now, pretend there's a big, dark, ominous line here. There's this world called Medicare Advantage, or Part C. The alphabet thing, frankly, just confuses the crud out of everybody. So Medicare Advantage, these are all the things that are sold by those half-dead football players and ancient TV personalities that you haven't seen in decades. These plans are a completely different universe from what we just talked about. So put on pause everything we talked about here. If you go to this planet, you have now told the government, I don't want Medicare from you. I want it from a private company, like Kaiser, for instance, or any of the Medicare Advantage plans. Instead of a single letter, have names like Secure Horizons, Alignment Sutter Health Plan, Aspire, HMO. So these are private company plans. They combined what the government would have done in A and B, plus some additional benefits usually. Most of them will include a drug plan. They are very regional, like by county, not by state. And so a plan with one company in my county will be different than the same plan or the same company in a different county. There's specific narrow networks of doctors that you need to use, and you need to get all of your services from that doctor with those referrals to doctors also in that system. But you do have nationwide emergency care coverage. There are limits and exclusions that vary very much by plan. You still have to pay Medicare, but Medicare is going to go, awesome, you don't want Medicare from me? Killer. I'm going to give this giant check over to the company you pick and say, take care of my friend here. See you later. Bye. So these plans all have co-pays, sometimes deductible, sometimes not. And you could be out more in a calendar year, potentially, than with a Medicare supplement, although they may be, in some cases, free or very low cost. In my county, they range from $59 to $89. It varies again all throughout the state. So our first decision when we are working with Medicare clients is when to enroll in Medicare. Our second decision, once we have Medicare, is do we want to have Medicare and supplement it? Remember our pooper scooper analogy? Or do we want to completely replace it with a Medicare Advantage plan? We give free advice all day long on those options and then help people enroll in the plans that will work best for them. It's not about what I would do, it's what you feel is going to be best for you, and will help you come to that conclusion. So for free assistance, this is how you can reach me. Again, you can go back to my website and it has a book now button all over it. You can contact me by email or by calling my office. I have 2 gals that work with me that will help you book appointments, do any service work, and also are licensed agents as well. So thanks for listening, and I look forward to assisting you in person, by the phone, on Zoom, sometime in the future when you need to unravel the mysteries of Medicare. Thanks for listening.